Is it safe to fly now?
To be honest, my advice is minimize air travel, minimize contact with people. We have a pandemic, in 6 to 12 months, the pandemic will be over.
It's really balancing the risks and the benefits of travel for the individual. I would say right now, as cases are surging throughout the United States, that those risks are higher. It's important to think about the family member that you're seeing and how vulnerable they are to severe manifestations of COVID, how vulnerable you are to COVID.
The most vulnerable people are those who are older and who have certain underlying medical conditions, including diabetes, heart conditions, obesity, smoking, a weak immune system. Risks of travel go up with the infection rates at your point of origin and your destination. But what if you do fly?
Transmission on an airplane does happen, but the relative number of cases reported on airplanes is on the lower side. So I think with good precautions, you can really work to minimize the risk.
The most important way to reduce your risk?
Face masks. Use them consistently, correctly, and use a well-fitting face mask of high quality.
Face masks are crucial because the primary way COVID spreads is through tiny droplets in our breath. These can hang in the air for hours, making indoor spaces especially dangerous. A well-fitting mask is snug around your nose and chin with no large gaps around the edges. You want your breath to be filtered through the mask, not flowing in and out around it. And when it comes to quality, the tighter the weave of the fabric, the more protection it provides.
If you as a passenger are masking, if your other passengers are also masking, this is very, very important. Wearing masks reduces your droplet spread and sort of contains it.
I personally would not eat on a flight because I would not want to take off my mask.
Which brings us to how you should behave on a plane.
So the nature of this virus is that it's driven by contact duration, contact proximity, and contact frequency.
And right now, with cases soaring, each of these factors is elevated.
Where people are close together, there is a risk. So minimize contacts. Do not talk to people. Ideally, never ever use a middle seat.
Making sure you're traveling with hand sanitizer and not touching your face or your eyes.
Airplane cabins might be safer than most indoor spaces.
The ventilation on airplane is thought to be better than the ventilation indoors, which is stagnant.
The air you breathe inside a plane is a mix of outside air and recirculated cabin air. Along the lengths of most aircraft, the air enters from overhead outlets, flows downwards, and leaves through grills near the floor. There's very little forward and backward movement of the air. In addition, every few minutes, the air is pushed through a hospital-grade HEPA air filter. While the plane is cruising, the volume of air in the cabin is exchanged every couple minutes.
Not only are the airplane filters very effective at filtering out coronavirus, it is also helpful in terms of how the ventilation flows. This helps really to decrease the risk of transmission.
But the issue is when you board or at the time of exit, often they turn off the engines and then the ventilations may stop.
Getting on and off the aircraft can pose the highest risk.
Waiting in your lines at security, and then there's always a rush when you exit. There's crowding. I think the risk is much higher in these settings.
Certainly being in an environment where others are masking and as much as possible maintaining 6 feet social distancing will certainly decrease those risks.
In the lead up to your trip, try to minimize exposure. And we should stress, if you have COVID or you think you might have been exposed, you should not be flying.
Symptomatic persons should not be traveling. They should not be in airplanes. They should be at home, self-isolating. Full stop. Therefore, transmission that is still occurring is then because of asymptomatics.
It's estimated that up to 40% of people infected with the coronavirus have no symptoms at all.
a simple symptom screen or doing temperature measurements, while it's important, won't catch all the people who are infected.
Due to the high risk of asymptomatic and pre-symptomatic spread, some airports and airlines are offering rapid on-site or at-home testing before you board for some flights.
They are not yet perfect, and they may not detect all cases, but testing is the way forward. So make sure that you do not spread it also from one country to the other, or from one state to the other, or one city to the other.
Testing passengers after they leave the plane and screening wastewater from an aircraft that's just landed won't stop the spread of COVID, but they can help with contact tracing.
If you want to be sort of extra cautious, quarantine after you arrive.
Right now, COVID-19 is surging across the U.S. Chances are higher now than at any other time during the pandemic that someone on your flight will be infected, even if they don't know it. And it could be you.
If we take precautions, I think we can minimize the risk of in-flight transmission.
That being said, it's not a zero risk, and so everybody needs to factor that into their decisions about travel.
And perhaps more dangerous than flying is the act of getting together with friends and family. Small gatherings have become increasingly responsible for the spread of coronavirus.
Wait it out. Next year it will be better.